Hello, class. My name is Hillary Adams. I am in my fourth semester of the Family Nurse Practitioner program, and I'm looking forward to taking this class with all of you. I have been a registered nurse since 2014, mainly in the emergency department, where I continue to work today. Here I am on the right. My coworkers, family, and friends know that I always have an initiative that I am promoting, as this photo demonstrates. This presentation will give all of you some perspective on my values and ethical code regarding healthcare, nursing practice, and social justice. In order to best present my philosophy, I considered what health is and how that definition is often fluid, the origins of science and art of healing, how the contemporary healthcare environment impacts health status, and reflected on my own nursing code, my professional integrity that I am unwilling to compromise. Before being able to determine what my health philosophy is, I think a discussion should be had on what health is. According to the Change Project, health is a life lived well and fully, a life involved with other people and with self-exploration of the emotions, the mind, the body, and the spirit. According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I argue that health is a continuum, not a static entity, and it is dependent on the conjunction of the physical, psychological, and social well-being of individuals, as well as their connection to the environment. Generations of humanity have demonstrated that our ability to adapt to the environment directly contributes to our health status. With this in mind, health varies between individuals, depending on their ability to function. Our job as healthcare providers is to assist our patients in adapting to their unique circumstances to promote holistic well-being. It is important as we go forward in our nursing practice and advanced nursing practice to determine what health means to our patients. One of my philosophies is that healthcare is a feature that is unique to humanity. When asked what the first evidence of civilization was, Margaret Mead, a renowned anthropologist, answered, "A human thigh bone with a healed fracture found in an archaeological site 15,000 years old." Why not tools for hunting or religious artifacts or primitive forms of communal self-governance? Mead points out that for a person to survive a broken femur, the individual had to have been cared for long enough for that bone to heal. Others would have had to provide shelter, protection, food, and drink over an extended period of time for this kind of healing to be possible. Thus, accepting personal risk to promote the survival of another is a primary characteristic of humanity. The discussion of healthcare philosophy must be predicated on the contemporary environment of healthcare and how that impacts healthcare access and provision. Factors contributing to healthcare inaccessibility, according to Healthy People 2020, include the high cost of care, inadequate or no insurance coverage, largely due to prohibitive expense, a lack of ability of health services, and a lack of culturally competent care. Last year, in 2018, the Journal of the American Medical Association reported that poverty, minority race, and low educational attainment are correlated with poorer health outcomes, which shouldn't come as a surprise to any of us. However, the difference in life expectancy between the top 1% and the bottom 1% of American earners was 10 years for women and 15 years for men. That's equal to the decrement in longevity from a lifetime of smoking. Individuals who are born into poverty are less likely to have access to health care in childhood, more likely to attain lower levels of education, and less likely to have access to health care in adulthood, perpetuating what researchers have coined the 21st century health poverty gap. Who deserves health care? This is the fundamental principle upon which healthcare philosophy should be based. And in short, and in totality, that is everyone. This is my personal philosophy on healthcare and on nursing. It is a fundamental human right which everyone deserves to have equal and full access to, regardless of their income, wealth, race, gender, identity, age, educational attainment, comorbidities, or any other quantifiable factor. Providing healthcare, especially in the framework of nursing practice, is a form of justice, as nursing is rooted in the art and science of healing, which by its very nature embodies equality. I intend to turn my philosophy on nursing and healthcare into practice. My ultimate goal is to start a nonprofit mobile clinic that provides medical care in rural Wyoming communities free of charge. 57 million Americans live in rural areas, and they have less access to healthcare. They have a lower average income. They have fewer opportunities for employment-sponsored insurance coverage, and a far larger health disparity than sub and urban settings. I believe that starting a free of charge mobile health clinic can help to level the healthcare gradient between wealthy and impoverished individuals and relieve the burdensome disparities that these disadvantaged individuals face.